So our cleanup speaker is Dean Rosen, who's familiar to many of you who've been at the conference in the past. He's a partner at Melman Vogel Castanetti, a law firm in D.C. Did not have enough to do there this year, so he founded a new company, Breakaway Policy Strategies, a new health policy research firm. And as you know from the bios and from seeing him speak in the past, Dean has been spent many years up on Capitol Hill working for Senator Frist on the Senate side, working for the House Ways and Means Committee, and has his own fingers on a number of pieces of legislation that had some controversy attached to them. But he's gonna wrap all this up for us. So, Dean.
Thank you very much. Thank you for having me back. It's a testament to the fact that the conference organizers probably don't read the reviews, but thank you for having me back for, I think, like the 12th year in a row. Margaret and Paul, thank you for inviting me. So a lot of the ground has kind of been covered by not only this panel, but the previous panel about where we are in ACA implementation. And so I'm going to start off with something a little bit different, I hope. I'm going to start off with something a little bit different, if I can get this to work. And that is to talk a little bit about the political context of where we are now on health reform and then where reform fits in. But I can't get my slides to advance, so there we go. All right. So, you know, why can't the political parties seem to agree on health care or anything? Then a little bit about where things stand. Again, Liz and Joe and Kavita have all covered a lot of that ground, as did the previous panel, so I'll go quickly over that to stay within my allotted time. Talk about the Republican perspective on this in a little bit more depth than Joe did, because I think that's part of my role with my kind of right-wing hat on, talk about that, and a little bit of the road ahead, which I'll sum up in 1 or 2 slides, and maybe a movie. Setting the stage. So first of all, what is going on in Congress against the backdrop of all this policy? And this is actually a Gallup poll from a year ago, but I think if anything, Norm Warnstein will tell you these numbers have probably gotten worse. And the President Obama, if you look at his approval rating among Democrats and his approval rating among Republicans, when you calculate that, has the biggest gap of any president, including George W. Bush at the height of the Iraq War, and Richard Nixon, and Jimmy Carter. So we are living in a really partisan time. And I know that folks will bemoan Congress as an institution, but in some ways I think it's kind of reflective of the broader division within the country. We also have a Congress divided. This is based on Census Bureau statistics, looking at the average congressional district, and Norm will talk about all this in much more articulate ways following lunch. But I was just shocked when you look at the differences among the average congressional district, House district, the percentage of white voters in those districts, 75% or 76% to 51%. Look at the Hispanic population. Look at the population density in the average Republican district, 165 people per square mile compared to 1,500 for Democrats. The biggest thing, presidential preference, Republican districts, Romney plus 17% voted for Obama, and the Democratic districts plus 28%. So you can see, and obviously the split on Obamacare, is it a good idea or a bad idea? Bad idea in Republican districts, not a surprise. So you can see, just in looking at that, a little bit of the reflection of the country. I have a couple of nominees for Jim Baumgartner's, like what's happening in one slide. This is one of them that I like. Looking at the middle disappearing. When I first went to work in Congress in the early 1990s, this is the ideological overlap in the House of Representatives and the voting records, according to National Journal analysis. There were about 250 members of the House and the Senate whose voting records, Republican and Democrat, overlapped. 344 back when I was in high school. But look at where that is now. 13 members of the Democratic caucus and the Republican Party that overlap. And so when you look at the districts and you look at the partisanship across the nation and you look at this analysis, you can see in a picture why it's difficult and why we're fighting over health care. So this is, I don't know, you go tell me at the end whether this is a nomination for the slide. So the result is we have a process where we talk a lot about different things, but if you look at this Congress, it has not enacted a lot. I think it was the 94th Congress or the 95th that was the do-nothing Congress. So they were actually pretty good compared to where we are now. This is based on the first half of the congressional session. So you can see that even if we double that this year in terms of laws enacted, we'll still be probably way below the lowest point since the 93rd Congress. The other result, you know this is the Gallup poll from June of last year. This has not gotten better. Citizens don't trust Congress. John McCain famously says that the 13% or the 10%, I guess, that do is down to paid staff and blood relatives. For you physicians in the room, I found this really shocking. I was with a member of the Senate at an event last year who said that back in his home state, that popularity of Congress is so low that he stopped introducing himself as a United States Senator and started introducing himself as his past job, which was a trial lawyer. So you know things are really, really bad. And so just to show you another quick snapshot here, it's not only differences between the parties, but I think what we're starting to see is differences within the parties as well. And the Republicans are sort of a famous example, and I just show you two pictures. If you look on the right, if you look at the primary challenges, the serious primary challenges in the Senate races this year, they're almost all in Republican states. So my party is kind of at a bit of a civil war with itself, and it shows up in the primary challenges, even in places like Kentucky, where Mitch McConnell, who's the Senate Republican leader, is facing a Tea Party opponent. Tennessee, Lamar Alexander, Thad Cochran, who's been in Mississippi for years. Even John Cornyn in Kavita's home state of Texas, not the most liberal member, but what's it really coming down to is sort of a fight, not really ideologically, but between folks who are viewed as establishment Republicans, which is kind of a dirty word now in the Republican Party, versus insurgent Republicans. And if you look at the other side, on the left side, these are key votes. And these are key budget and tax votes. I didn't take all of them, like the Violence Against Women's Act and Hurricane Sandy relief, but just look at these major votes. Debt ceiling, the Patty Murray, Paul Ryan budget agreement at the end of last year, the agreement brokered between Majority Leader, Senate Majority Leader Reid and Republican Leader McConnell, which is one of the reasons he has a primary challenge. And the numbers on that page in red are the number of Republicans who voted against the bill, against the speaker, on those critical bills. And the last one, to raise the debt ceiling just a couple weeks ago, 199 Republicans voted against a clean debt ceiling in the House. So you can see some of the divisions on display and what the House leadership has to do in terms of necessity to get stuff done. So I'm going to come back to healthcare in a minute, but just because I want to be fair to the Democrats too, guess what? They've got some differences in their own party, and these are all Democrats who are running for re-election in the Senate in states that the president won, who are, in my view, taking steps to significantly distance themselves from the president on things including health care, where they're introducing bills to make changes on 30-hour work week and other things where Jim and his friends at CBO are causing problems for Democratic supporters of the law by coming up with jobs numbers and other things. So not only divisions across party, but divisions within the party. So let me focus for just a few minutes again on the ACA. This is my attempt to sort of get all of this very complicated law into one single slide. The insurance reforms, the tax reforms, the employer requirements. You can put this on your refrigerator next to Jim's chart, or maybe this would be like a really nice placemat because it's really colorful. But you know, obviously, I think Kavita put this really, really well. The law does not have a singular focus. There's a lot. If you just took one of these boxes, in fact, we've done these boxes before, insurance reforms or Medicare reform. I've made this point before. If you just took the Medicaid expansion alone, that little purple box, and the second to the right on the bottom, left on the bottom, that would be like the most significant healthcare law, you know, ever passed in the last 3 decades. But that's only a small piece of a big piece, but a small piece of the law. And a lot of this obviously is happening this year. That's why go live, that's why there's been so much focus, and we finally moved from all the discussions we've had back when I was here in 2009 and 10 and 11 and 12 about when this was going to happen and what was going to mean to not only the politics of the theoretical, but the politics of the actual and what people are actually seeing in their coverage and in their experience interacting with the website and other things. So just to make the point that, and you saw slides on this earlier from from Jim and others about where the enrollment's going to come from. Most of the enrollment, so I won't spend time on it, comes from two places, from the Medicaid expansion and from the exchanges, and that makes sense because that's where the major subsidies are. I think Liz showed a version of this picture about the states expanding Medicaid and a version of this about the state insurance exchanges. And I would just make the point in sort of the defense of the administration, I won't spend too much time defending them, but in defense of the administration, that this was a law both in the insurance exchange piece and in the Medicaid piece that was a national framework, but significantly relied on this partnership with the states to carry it off. And guess what? We have a majority of Republican governors in the states. It's a very, very hard handoff to make in compared to the Health Insurance Portability Act and a lot of other smaller laws where there was reliance on the states. So I'm going to focus on what I would, I think, charitably call 6 big implementation quote-unquote challenges. That's my attempt at trying to be bipartisan as opposed to screw-ups. And again, we've covered them, but I wanted to kind of put some of this in one page. Murray, how am I doing on time? Okay? All right, good. All right. So website, policy cancellations. I'm just going to talk about each one of these really briefly. So initially what we saw was this very, very rocky rollout of the Affordable Care Act, and dominating the news coverage was just all the website problems. And actually, I would say to both Liz and Kavita that while there were significant issues in Part D implementation, there were many, many more seniors who visited the website in Medicare Part D, and there were many, many, many fewer glitches with enrollment. Now, this is a much more complicated program, so it's hard to make apples comparisons on the pro side or the con side, but the fact that the website didn't work was clearly like a self-inflicted wound. I mean, the administration had 4 years to do it. It was a basic, do we trust government to do this? And this, made a lot of hay. The second story that came out sort of in the aftermath of it was people losing their health plans. And you know what? This is the Kelly file from Fox News, but it really was the best picture, so I just took it. But here's the thing about this story. When I asked members of the Republican Party which piece of the first couple of months of the Affordable Care Act is the biggest political problem for the Democrats, which do you think you can make the most hay out of? They all said this, the policy cancellations. And why is that? I'll give you two little stories. One is it's just devastating. We always talk about the law. Is it going to help me? Is it going to hurt me? And I think most people up until this point thought about this law as helping somebody else. Somebody who didn't have insurance, it wasn't going to change the world for them. But when small business owners and individuals, whether they're getting better coverage or not, felt that the president was standing up as sort of a nanny state and saying, well, we know what's better for you, but what you had is going to be canceled. That was a real problem, and I remembered polling that we had done right after passage of the Affordable Care Act, the Part D program, and doing it. I was working for the Senate Majority Leader Bill Frist at the time, who was a doctor, and all he wanted to do was to go onto the Senate floor and into these town hall meetings and these editorial board meetings and talk about how we provided $400 billion worth of drug spending, and it was going to provide all these medical benefits, and people were going to get their drugs paid for, and it was going to be important, it was going to keep people out of the hospital, and we'd always show them the polling and remind them, when you go in, before you say all of that, the first thing you have to say, the very first thing, which is polls off the charts compared to all that stuff about people getting all their medications, is if you like Medicare as you have it, you do not have to change. If you didn't say that, then the conversation went south. If you said that, everything else you said was fine. So that's why I think this is a big problem, had been a big problem for the administration. The other story is the jobs. And we talked about the CBO numbers earlier, so I won't parse them. But the fact is, it's not the fact that people are disincentivized to maybe work or incentivized to maybe, as Nancy Pelosi said, people may want to become artists and spend more time painting and pursuing other things as opposed to working at jobs. That's one thing, but it's actually the fact that the requirements, which the administration itself has delayed in terms of the penalties on employers, are creating disincentives for hiring and are making it more expensive and more difficult. That's the other story. I, again, don't think it's as big as the cancellation story. The problems with the website, as Joe talked about and others talked about, translated pretty directly into enrollment, actual enrollment that did not meet whatever the projections were. Projections are always wrong. Sorry, Jim. The projections are always wrong. But setting expectations is a huge part of the game, so the fact that the numbers didn't meet it. And I think the bigger issue is going to be that we're counting enrollment. I don't think this has been said yet today, but we're counting enrollment. Joe touched on this a little bit, based on the number of people who have indicated that they want to sign up for a plan. The real question will be, do people actually pay their premiums when they come due? And you say, you've got to pay a $1,000, $2,000 premium per month compared to facing a couple $100 penalty next April. So that will be a question. And then the administration itself, I counted about 6 or 8 just sort of major delays on the way to enforcement, which you can say they did it for good reasons. It wasn't ready, the shop exchange, the small business exchange, but it undermined confidence in the law itself. And I just kind of highlight the fact that for those payers in the room, all these regulations, which we love, pre-existing conditions, the most popular things in the law, also create all kinds of pressure on the system, including pressure on the downstream providers and innovators. I think I'm going to skip this slide in the interest of time, but just to say that soon after we get through the enrollment issues right now, within the next month or two, health plans are going to have to decide, right, Murray, whether you're going to participate in the exchanges next year, what the coverage is going to be looking like, and all the uncertainty around things getting delayed, around Democrats in the administration deciding to do that, Republicans on Capitol Hill saying they might repeal parts of the risk corridors. All that creates great uncertainty. So let me come back to politics for a minute. What's happened? 5 minutes, I can do that. What's happened as a result of it? Well, the opposition to the law in the implementation phase, and it may change, has grown. And in the short term, when you look at just the next election cycle, which is, let's be honest, all that most people in Washington really care about, is that it's been bad. So you can see this is the Kaiser Family Foundation, not the most conservative organization in the country, and what they found is, if you look at the slide, the support for the law and the unfavorability, you can see it kind of limped along. People liked it, didn't like it. There was a little bit of a glitch back in October of 2011, but for the most part, the country's pretty divided. But when the things started to be implemented, you can see the unfavorables climb. So that may change over time. This is the latest, I think, January. We'll see at the end of February what the latest polls show. But right now, it is unfavorable. And the news coverage has been mostly negative, and obviously that's reinforced it. This is not just Fox News, but everything, and that's reinforced the story. So, we often govern by anecdote, and the fact that you have a lot of really bad anecdotes out there does not help, but the fact that most people either don't know about it or feel that they're seeing negative coverage is a problem. And the latest Gallup poll shows that the president's approval ratings are upside down. This is the worst of his term. And again, you can look at the approval ratings over time, and it largely tracks in the last few months the implementation of the Affordable Care Act. So has it been the only reason that the president's approval numbers are down and declining? No. Could they improve over the next year? Absolutely, they could. But the point is, the politics and the practicality of implementation have clearly intertwined. And the same is true for Democrats in Congress. This is just a generic poll asking, do you favor or support voting for a Republican or a Democrat, generic, in Congress? And if you look back in October across the ABC News, NBC News, and Fox polls, they all had the Democrats +8. You come to January, what happened in that period? The government shutdown, which hurt Republicans, but also the rollout of the Affordable Care Act. And in every one of those polls, the Republican numbers improved, even NBC, where the Democrats are still ahead, but they went from +8 to +2. So clearly there's a link, and people in Washington pay attention to that. And I thought we've had such a good discussion of the substance that I would sort of focus on some of the challenges and some of the political impact. As I said, let me just talk in my remaining couple of minutes about the Republican opposition, just to make the point that when you also look at this, the same Kaiser Foundation poll that came out, it underscores a point that when you ask people, as John Gable did, not only what do you think is going to happen, but what do you want to happen, most people, I think, accept the fact that this is the law of the land. Now, a lot of the folks in my party do not support that, but most people, and you can see this, support the fact, the total public, that it is the law of the land. And that's why you saw, not only in the President of the State of the Union, but in the Republican response to the State of the Union, the Republican speaker said, no one wants to go back to the way it was, but we've got to do something better than the Affordable Care Act. So the prescriptions, the policy prescriptions, the philosophy is significantly different. But I think that's one of the reasons you've seen this shift from the 40-plus Republican votes we saw over the last couple of years in Congress to repeal and replace the law in total, and the government shutdown that I think Ted Cruz orchestrated, which was, remember, a result. Why did we shut down the government? Because they were using that as leverage to try to stop the Affordable Care Act. We've seen that shift from just a wholesale repeal and replace to a government shutdown, which I think reverberated and backlashed against the Republicans, which is why you saw John Boehner say, you know what, I'm not going to kowtow anymore to my guys. I'll do it as much as I can, but at the end of the day, if I need all Democrats to pass the debt ceiling, I'll pass it all with Democrats. To a policy focus now where Republicans are actually trying to move legislation on specific things that they believe are unpopular. The individual mandate, data and security of the website, the risk corridors, I think most significantly some of these jobs issues. I think the Ways and Means Committee voted last week to move a bill that changed the definition of full-time employees because of this concern. To what Joe touched on earlier, which is an increasing number of Republicans, House and Senate, who are saying we need a comprehensive alternative. 3 Republican senators a couple weeks ago introduced one. I think some Republicans in the House will introduce their own bill. So I think, to me, this is a showing of a debate that's kind of maturing from hell no, we're against all of it, to we're going to look at targeted things that are solutions, to we're going to put up a comprehensive idea of our own. So I think that's a little bit of how things have evolved. And I'll conclude just with this and leave time for questions, which is I think, to me, it really all comes down to an argument that's going to happen between not only now and next time we're together, and hopefully you'll invite me back, but I think now in the next couple of years. And this is the way the two parties very differently sort of look at the situation. But I think, again, back to my very first slide, a lot of America looks at the same law, the same act, thinks about it very differently. The question is, what happens if you can't keep your plan? Now we're up to almost 6 million cancellations. Your doctor, because of the narrow networks, your premium's higher, or your job. That's the Republican talking point. Versus the other side, which is no one's going to be denied insurance because of pre-existing conditions. We're going to have about 20 million people who are going to be newly insured with better preventive care, with broader coverage as a result of the essential health benefits. And to Joe's chart about who's signing up, for those who had the most trouble paying before, the older and the sicker, there actually are finding, I think will find, that premiums are more affordable and more stable. So to me, in one slide, this is going to be how the law is fought out, shaped, and defined over the next couple of years. I will say, if you look at the elections ahead, to simplify it, the Democrats are probably going to hold on to the Republicans are going to hold on to the House. The Senate's a bit of a toss-up if you just look at the numbers of safe seats, lean seats and likely seats and where it is. And I'll conclude briefly. I did not have a movie slide. And usually, for those of you who've come before, I usually try to capture the mood in Congress or the outlook on healthcare policy or legislation in a couple of different movies. But when you think about the Academy Awards this year, I mean, these are great movies, but for titles, they all really suck. Captain Phillips, I mean, how can you really build anything around Captain Phillips? Or Her, has anyone seen Her? Is it good? I've never seen it. Nebraska, I mean, there's really nothing about Nebraska that's significant. So I had a really hard time, except for American Hustle, which was just so obvious that I couldn't use that. So instead, in the past, just to remind folks, I've talked about the year before it was unclear whether we're going to pass legislation or not, and where Republicans and Democrats stood. I mean, that was a year of great movies. The Democrats, I used Revolutionary Road, right? And the Republicans, I said they were all about doubt. So, you know, we just don't have that this year. But for me, well, I was thinking about two things. I was thinking about Jim's numbers from earlier about where we are, the fact that policymakers in Congress failing to address these major fiscal and debt challenges we have, and at the same time adding to the burden by expanding government with a new significant health care entitlement. So I was thinking about that, the little bit of a out of touch with reality, and also thinking about my slide on the collapse of the middle in the United States, and the fact that you've got, you know, Republicans who watch Fox News and Democrats who watch MSNBC, and the fact that the parties, you know, they don't talk to each other. They're really kind of reinforcing themselves. And I thought the one movie that really summarized that for me was Blue Jasmine, the Woody Allen movie. Cate Blanchett, by the way, should win the Academy Award for Best Actress. Why? It really was an allegory for me that encapsulates where we are. This lack of being in touch with reality. You see Cate Blanchett, this Manhattan socialite, travel across the country to here in California. She's broke, but she's flying first class. She's carrying Louis Vuitton luggage. And at the end, this notion of just the parties kind of talking to each other, not really working together across the aisle. You see her at the very end of the movie on a park bench communicating only with herself. So to me, that was the one kind of allegory for where we are in a year of what I thought were tremendous movies, but very, very bad in terms of trying to come up with titles that reflect where we are in Congress. So as Kavita said, the SGR is the one kind of shining example that's different than that. And with that, I will conclude and thank you very much for having me back.